The rise of AI in medicine, who's responsible? What happens when a machine makes a medical mistake? Who's accountable when AI takes the reins in healthcare? Imagine a world where AI-powered medical tools can detect diseases with unprecedented accuracy, but what happens when they get it wrong? Welcome to our channel. Today, we're exploring the rise of AI in medicine and a crucial question: who's responsible when AI makes a mistake? The rise of AI in medicine. AI is transforming healthcare with its ability to analyze large datasets and provide accurate diagnoses. From detecting lung cancer to predicting hospital admissions, AI is becoming an essential tool for doctors. Examples: IBM Watson Health, Google DeepMind Health, iNuke. The liability conundrum. As AI takes center stage in medicine, a pressing question emerges: who's responsible when machines make mistakes, and patients suffer the consequences? Physicians might shift liability to developers, while developers might point to doctors making the final decisions. The lack of clear regulations and guidelines creates uncertainty and raises questions about accountability. Consequences of wrong AI use in healthcare. There have been instances where AI errors in healthcare have led to serious consequences. For example, a study found that an AI system used to detect breast cancer misclassified 10% of benign tumors as malignant. Another example is the case of a patient who was misdiagnosed with a condition due to an AI system's incorrect analysis of medical images. A 2019 study published in the journal Nature Medicine found that an AI system used to detect diabetic retinopathy had a high false positive rate, leading to unnecessary referrals and anxiety for patients. There are valid legal concerns regarding accountability, privacy, and regulatory compliance. AI tools rely on access to patients' health data, which raises questions about data privacy protections and transparency. Examples: HIPAA regulations, FDA regulations, concerns about bias and fairness in AI decision-making. To resolve the issue of liabilities, precise regulations, accountability mechanisms, and technical standards are needed. International collaboration between governance and healthcare AI will be crucial in balancing innovation and public well-being. AI systems must provide transparency and explainability to help clinicians assess the reasoning behind a diagnosis. By working together, we can ensure that AI is used responsibly and benefits patients and healthcare professionals alike. The rise of AI in medicine holds great promise, but it's essential to address the challenges and uncertainties surrounding liability and accountability. By understanding the consequences of wrong AI use in healthcare and working toward solutions, we can harness the power of AI to improve patient outcomes and healthcare systems. Thanks for watching. If you have any questions or comments, please leave them below.